All right, let's take you to KZN now, where Premier Sihle Zikalala has just wrapped up an update on the province's response to COVID-19. The Premier says he's concerned that people infected by COVID-19 report to hospitals late. He's added that they have sufficient capacity to assist people who need hospitalization and those who are also in need of a place in the ICU units. The province has had the highest number of active cases in the country since the second wave of the pandemic swept across the country. Newsroom Afrika's Bonga Dlulane is watching the story for us and joins us now live from KZN. Bonga, the idea of people reporting late to hospitals certainly adds a whole lot more complexity to an already difficult situation. No doubts this was top of mind for the Premier.
Yes, that's the issue here, where the Premier basically saying, accompanied by his MEC for Health, Bonga Zulu, that that's the biggest concern they have, because it's hard to trace these people, and that when they do come into the hospitals, the virus has progressed so much that some of them are beyond help. There's not really they can do to help them, because the virus has spread. So they're appealing to people, basically saying they have to come to the hospital as soon as they suspect, or any health facility rather, as soon as they suspect that they might have the COVID-19. If they're presenting symptoms, they must go, because the province has those capabilities. And also adding to the complex fact of that, these people also who die at home or don't come to hospitals infect other people. So contact tracing is hard, because they don't know who they come in contact with. So it presents another issue there, because they go out and then they infect other people. So basically saying that they're very, very concerned about people who think that they've beaten COVID-19 or they're taking remedies at home, saying that if you believe in certain remedies, you want to take them, but still come to the hospitals, come to the health facilities. Only a doctor or a nurse or someone else who's a health practitioner can confirm if you have COVID-19 or not. Basically saying that that's the biggest worry right now, is that people don't report to hospitals and clinics early as the virus hits, and saying that even if it's a cough, a sneeze, you must come to the health facility and then they'll test you.
Yeah, and it's interesting remarks, isn't it? Especially once you consider it in the context of that video that's gone viral on social media showing one of the hospitals in KZN appearing to be incapacitated, for lack of a better term, where patients are lying on the floor and there's an appeal for help with no one in sight. How, did the Premier even take time to address those type of concerns? People are worried that a hospital is where you might meet your end more than meeting the treatment you need.
Premier Zulu was the one who addressed those issues, and saying that they've already even set up, field hospitals where they can, or they're going to set up lodges or hotels like we saw when the first wave hit. So basically now saying that there is no problems with them at hospitals at the moment. All the hospitals are ready, saying that the only issue is that if you live in Umlazi and you're coming to a hospital and you need to be hospitalized, you might not be hospitalized there, but hospitalized other area. But you're saying that they have enough capacity in hospitals, they have enough capacity that even some of their health facilities have not even been open. So that he's saying that it's a myth that at the moment that they have issues with capabilities, they have issues with capacity, they have issues with beds, saying that 63% of their beds have been occupied, but that only 53%, and then 57% of the ICU units have also been occupied. Basically saying that for now, still things look good, so there's no issue. They did admit that you cannot, everything is not perfect. As you mentioned, that hospital saying that there are investigations going on. That if certain people have reporting, people have been not being treated, they don't have the right nurses, they don't have the right being treated by the right manner. Basically saying that it's not perfect, but their response right now, they're satisfied with it, because at the moment they're coping with everything that they can, and that if they need be, they'll reopen those lodges. You remember we saw at the first wave, if they need to go to hotels, they'll go to hotels and ask for space. If they need to empty buildings, they'll do that too. So basically, the Premier and the MEC for Health saying that for now, the way they respond to the virus is helping, saying that they're happy that they have capacity, they're happy that they have enough beds, and that if they need be, then they procure more. But for now, saying that it's a myth that this province is struggling with beds and hospital space for people who need it urgently.
Right. A lot of attention now being given on a vaccine rollout plan, whatever form this is likely to take. Did the Premier shed any light of what plans they're making to roll out vaccines in the province?
He said that under that they're going to take the cue from national government, but the moment that vaccine is provided, they have a rollout plan that includes them trying to inoculate people, first trying to inoculate the ones that need it most. I'm sure you already know by now there's a whole debate as to who needs to be inoculated first, but the Premier being very clear that as a province, they're standing by because they are ready to dispense that vaccine as soon as it comes. But he wouldn't go into details because saying that they are engaging with the Minister of Health, Mr. Debunking, and that they're also taking the cue from the national government, how national government will disseminate it, which province gets what first, because you remember that KZN has one of the highest active cases right now in this country. So those are the issues too, saying that they want to address that too, and that the economy is so hit, and that the hope that they have relies on the fact that a vaccine must come, because tourism department, Durban depends on a lot of tourism, and we've seen that plummet to over 63%, the people who visited this province last festive season, and are saying that the only way now they hope that this will recover the economy, the tourism department, and also all the business have to shut up because of COVID-19 regulations will be helped greatly by a vaccine, and then they'll start to see a recovery plan. But going to details to telling us how the plan will work, saying that they'll take a cue first from national government, but as a province, they're standing by to ensure that everyone who needs that vaccine is inoculated, and then it will depend on how government proceeds who gets it first, and that's where they want to take it. But basically saying that the province's hopes for economy to recover hinges on that important vaccine.
Absolutely. And with a mortality rate of about 2.3%, I think is what the Premier said, there's a whole lot of urgency to ensure that the inoculation goes ahead unhinged in KZN. How much time was given to debunking some of, call it myths, misperceptions around COVID-19 vaccines?
He reiterated that again, that people must not go around saying that they've beaten COVID-19 or that they're immune or that once you get it, you can't get it again. He spent a lot of time basically saying that those are just myths again, and those are dangerous ones, saying that people who have tested positive, who have self-isolated and have come out negative again, have a responsibility to still continue treating this as something that they can get again. He also was very, very supportive and also trying to say that to people who are practicing social distance, who are people who are self-isolating, people who are staying at home, that those people are the ones that's the way you have to treat this thing. And also, he was very emphatic about the fact that people have to stop with this thing that COVID-19 is related to 5G. It's something that he says it needs to be demystified, because it's telling people that being close to towers, cell phone towers, Vodacom or MTN or any of the big telecommunications one, that those ones that cause the COVID-19, he said that there is absolutely no truth to that, and that people have to rely on scientific data that COVID-19 is spread through movement, super spreaders such as hotels, such as funerals, super spreaders such as alcohol-related places have been closed because of that, and that is saying that they're seeing more young people too being admitted to hospitals because of the way that they move, and that is appealing to people not to believe anything that's not substantiated by fact, but to believe what scientific data tells that how COVID-19 is spread. And they spent much time trying to say again and again that they cannot every time be telling to people you have to be careful and stop spreading fake news of how you can beat the COVID-19 or you're immune or that there's a vaccine that works. Like we've seen that people saying that they eat the home remedies and they heal. So basically saying that if you believe in that, that's fine, but that still needs to be confirmed by a doctor or a nurse, and that the only way to beat COVID-19 is to follow the protocols that we know.